Hello, my name is Jen, and I'm a registered nurse here at PacificSource. I work in the health management department, and what I do is I help support members who live with chronic disease. So today, what I am here to talk to you about is GERD, which is the acronym for gastroesophageal reflux disease. We did publish a little article on the blog, on the PacificSource blog about it, and we had some questions in response to that article, so I'm going to answer your questions today. So the first question is from Tiana, and she says, I finally have my GERD symptoms under control, but in the process, I had to completely cut out coffee and alcohol. Any tips on how to introduce these back into my diet without flaring up GERD again? Well, yes and no. How's that? Yes, I do have some tips. With any kind of adding a possible irritant back into our diet, by that I mean anything that might flare up your GERD symptoms, go slow and pay attention. So if you want to add coffee, for example, back in, have a little bit. Maybe try decaf, because caffeine can actually aggravate GERD much like the acid in the coffee can. So have a little bit, really observe what it does in your body, not just in the hour after you have it, but over the next couple of days. And so go slow, pay attention, and see what happens in your body. And the reason I said yes and no at the beginning is because it might be that starting those up again can put you right back at where you were before. So it may be that that's something you need to just not have in your life. So it's going to be different for every person. So just try to be really observant about your body and your triggers. And if you want to add those things back in, like I said, go slow. So the next question is from Tiffany, and she asks, is it accurate that over-the-counter GERD medications can't be used for more than 1 week at a time? And that's not strictly true, but it is recommended that if you have symptoms of GERD that you're needing to manage with over-the-counter medications for 2 weeks or up to 2 weeks, that you really go in and talk to your doctor and see if you can't figure out what's going on, make sure you're on the best course of treatment for your body and your symptoms, and maybe look at other things in your life that you could modify. So are there certain foods that trigger it? Is it happening at a certain time of day? Are there other things that you can do in your life to help yourself not have those symptoms in the first place? Because if you can not have GERD in the first place and not take the medication at all, obviously that would be the ideal thing. So you can take over-the-counter medications for more than a week, but you have to follow the directions on the label. If you're taking them frequently, more than a couple times a week, you really should get in and talk to your doctor and make sure that there's not something bigger going on that you might need more help with. The next question is from Travis, and he writes, I have suffered from GERD for years. Lately, when I'm eating, I sometimes get food stuck in my esophagus. Could these issues be related? Now, they could be related, Travis. I think that one of the most important things is that you work with your doctor to make sure that there's not something more serious going on. But GERD can cause scarring in the bottom of the esophagus, and that's that tube that goes from your mouth down to your stomach. And when the acid splashes up from your stomach into the bottom of that tube, it can actually cause injury and eventually scarring in there. And that can cause something called strictures, which is essentially where the tissue, the lining of the esophagus and the esophagus itself can become so scarred that it actually starts to close up and get more stiff. And there are things that can be done to help that. But again, if you're having problems where you're struggling to swallow, food's getting stuck, all of those things, you really need to check in with your doctor and make sure that there's not some other process, some other disease process going on. So, and the final question is from Paul, who asks, what are the most common foods to avoid? And I think that the foods that you want to avoid primarily are foods that are acidic. So things like tomato-based products, whether that's pasta sauce or salsa, foods that are spicy, alcohol and coffee, caffeinated beverages like we talked about earlier, And some people really have a strong reflux response to mint. So that's another thing that you might want to think about. And because everybody's symptoms are different and everybody's triggers are different, if you find yourself having regular heartburn, regular acid reflux, regular symptoms of GERD, or you've been diagnosed with GERD by your doctor, then it's probably a really good plan to keep a food diary and start to really notice what foods you're eating, what time of day you're eating them, and then how strong your symptoms are in response. So that's, I think, what I would recommend as far as foods to avoid is really notice what's up with your body and pay attention to what's happening with your body because everybody's different. So thanks a bunch. Have a great day.